Welcome everybody to GoLocal Live. I'm Josh Fenton. Thanks for tuning in. Looking forward to another complicated day dealing with the pandemic. The best news is the sun is shining and it is a gorgeous day in Rhode Island. So we'll take advantage of that one. Joining us is Dr. Michael Fine. Dr. Fine, thanks so much for joining.
Josh, it's great to be here and also great to see that sunny day. We needed it.
We certainly do. Let's jump right into the numbers. As you flagged to me yesterday, the numbers were a little lower in Rhode Island, in part because there'd been less testing over the weekend. The testing numbers were down. The testing numbers was reverted back to a little more normal level. What are the numbers?
Well, let's do the Rhode Island numbers first. As you said, in the prior 36 hours, it looks like there were 2,400 people tested, which is up from the 1,800, I believe, the day before, but not as many as 3,000, obviously. And with 2,400 tested, we had 321 positives. And unfortunately, 12 new fatalities. The hospitalization numbers are pretty stable. And it's the hospitalization numbers that really predict capacity. So on the Rhode Island side, it looks like things are stable-ish, but I can't tell you how many days of dropping numbers of positives we're going to get, because our positives today are up over our positives yesterday, which is just no surprise, given the difference in the testing. Around the world, 3.1 million cases, up 80,000. So from a world perspective, it looks like this disease is raging on, and my guess we'll get different parts of the world with different speed. I think Britain's being hit pretty hard. I'm scared of what happens when it really gets established in Africa and South America, where it hasn't been hugely established yet, by and large. In the United States, where 1 million, up over 1 million cases. That's down a little bit, but again, we've seen a downward trend over the last 3 days. We'll wait and see how that plays out over time. World deaths continue to be 7,000 a day, kind of heartbreaking, 220,000-ish. In the U.S., we're over 59,000 deaths, higher than we were the day before, higher in terms of the change, and we will cross 60,000 today. The big flu years, the number of deaths we see are 61,000. So I think we're going to blow by that this week, unfortunately. I think the take home is that the disease seems to be quieting a little bit in the U.S., but not enough to begin to celebrate or declare victory. And how that plays with the loosening of restrictions in a number of states, is unpredictable. I think it depends on population density of those states more than anything else.
Yeah, it doesn't, even in those southern states, primarily southern states, although Colorado is one of the states that's loosening restrictions as well. In those southern states, like Georgia, it does not seem that the consumer per se, or even the businesses, are blowing things open and racing back into crowded environments. Consumer traffic is reported to be fairly low in most situations.
Yeah, I think people are going to be cautious and careful, particularly in densely populated places. And, one of the real struggles that I think we have as a nation and as a state is to understand how the disease transmission dynamics are different in densely populated places than in sparsely populated places. So, in places in the peach trees in the middle of Georgia, where in the peach farming areas, my guess is that, there's not much to worry about. But in the middle of densely populated Atlanta, or other densely populated cities in Georgia, I suspect we're going to keep seeing disease spread. And that's going to be heartbreaking because it reveals the disparities that already exist. It will amplify those disparities. So In the countryside, not much is happening. In the cities, in the Atlanta is kind of the capital of African American life in the United States.
Yeah.
I'm afraid that Atlanta is going to get ravaged.
Yeah, Dr. Anthony Fauci made comments yesterday, I think from the, wasn't the National Press Club, National Economic Council, I think it was, and he offered two warnings. One is, as we lift restrictions, we're going to see a lot more deaths. And I don't think that's a surprise to any of us, because it does correlate to the number of exposures and thus the number of cases. Secondly, he, like CDC Director Redfield last week, really warned fairly sternly, I think to get people prepped, that the fall and the winter are not going to be our friends as we see second surges. Your thoughts on what, that's a realization, what can we do now to minimize that? And as part of that, on the hands of those procuring PPE and things like that, to really, really not let up and step up the supply chain to make sure that we're in good stead?
Well, I will reiterate what I've said before. Keeping the supply chain robust is important. Keeping the hospital and ICU capacity we've developed is important. But equally important is developing medical isolation and getting the courage to do that. I think temperature checking, which has been done in other places, makes a lot of sense to me. I think testing asymptomatic people and getting people who are sick into isolation, sometimes medical, makes a lot of sense to me. Those are the kind of things that I think are going to matter. And then I wonder if we shouldn't be experimenting with different scheduling. So, we struggle with, well, do colleges come back in September? Do schools come back in September? I was trained to think of schools as kind of petri dishes where things like the flu go to be bred and spread. We always used to say that 6-year-olds spread the flu and their grandparents die of it. So the challenge is, can we think of some different scheduling process that might help disrupt disease transmission? Could we do something like an every 1 month on, 1 month off process for education? Because that might disrupt disease transmission. I think those kinds of really out of the box thinking around disease transmission in the social environment is what we need to be working on today.
So much of our lives, in our pleasure, in our mental health, in our expressions of ourselves, comes from these group experiences, whether it's a Red Sox game, whether or not it's a concert at Newport Folk Festival. How do we deal with that? I mean, I think in part you made your name as the director of health in Rhode Island because you really expanded people's thinking about mental health issues. How do we, Zoom isn't going to do it. Microsoft meeting isn't, it's fine for the team meeting in the corporation, getting the watchword out, but that's not the same thing as that enjoyment of hearing great jazz in Newport in the middle of the summer.
Well, I think we're all going to have to compromise some. It may mean that we learn more from the Swedish model and open things up for young people and keep them closed for older people, as I'm in that group. So, I don't want to give that stuff up, but I may have to for a year. Understanding from a mental health perspective, this is a year, it's not forever. So, maybe we do some of that. Maybe we find other ways, for people to be together briefly. Maybe we get advanced about antibody testing and start to try doing, 50 or 100 people events with people who are antibody positive and really do a good job checking to see whether there's disease transmission as a result. Those will all have to be part of basically social medical experiments to figure out what's safe and what's not safe until we get a vaccine.
Your thoughts on this yin and yang between opening up and economic recovery, knowing that there is a breaking point of best practice public health if it doesn't really work if there's no economic recovery in the near side or potentially even in the longer term, and that some are starting to warn about because of unemployment numbers, decreased economic performance, loss of global trade, et cetera. Where is it that, as you as a public health expert begin to say, you know, the science is still against us, but we've got to do something to be able to have a viable community?
Well, I mean, you know, the economy is health to a certain extent. You know, not the economy at the expense of everything else, but, you know, if we can't live and eat, then what's our health for at the end of the day? So I think this is about doing this in a way that's smart and disciplined. You know, like opening, if we have to open, you know, as we open, well, we haven't closed factories,
right?
But for workplaces that we open, I think we need to be testing obsessively. And then I think we have to have the backbone to close places for 3 or 4 weeks when there are outbreaks. I think we're trying to, you know, sort of, do two different things at once. We're trying to open and then not close. But I think we have to have the backbone to say when there's an outbreak, we close for 3 weeks. We get that population dynamic changed in that place so that we can open it again safely. We just are not going to be able to have the same, you know, like everything applies to everyone in exactly the same way. We're going to have to be studied, precise, and evidence-based.
Dr. Mike Fine, as always, incredibly insightful and also very flexible. I do want to, you know, some other experts around the country seem to be stuck on one narrative, and I think this disease has just taught us that as much as we know so little about its dynamics, and you've been remarkably morphing as we learn more about the disease. Last word to you, sir.
We're doing amazingly in Rhode Island. You know, our numbers are such that we are doing well. We're not there yet, but we are taking care of each other. But this is the opportunity to understand how we all have to take care of every single person, that if there's a place like Central Falls or Providence that's hurting, we need to bring the resources that are necessary to fix it, and those resources may be different than the resources we need for Block Island or Situate or Smithfield. But if we keep our eye on the ball and take care of each other, we're going to get past this best.
Dr. Michael Fine, thank you so much. From a scheduling standpoint, we'll have Governor Raimondo at 2:30. Again, she does not take press comment, questions or follow-ups so that the public can hear it. Very unusual. Only one other governor in the country, I believe, has that policy. And then at 4 o'clock, we'll have Health Matters. One of the top orthopedic surgeons in the state will be joining us. Everybody else, stay safe. Much coming up on GoLocal. Stay tuned. More e-blasts going out with the latest information. Thanks so much, everybody, for tuning in.
Thanks, Josh.